I think it is. We talked about Katie Kelly. She just had the editorial in New England Journal 2 weeks ago, and I think you always have to be careful, that you interpret it appropriately. That the study that they published had highly selected patients who'd been deemed not risk for bleeding based on endoscopy. They were really the Olympic athletes with hepatocellular carcinoma, but the patients did much better with the combination, a very impressive result. And I think it clearly establishes a standard for the patients who are fit. I think Katie, though, presented data that may move that aside. In her combination of a CTLA-4 and checkpoint inhibitor that she presented, which looks even better than the atezo-bev. We'll have to see ultimately when Himalaya, the study, is completed. But very striking results. And as I said, the most coolest thing about the study that Katie Kelly presented is finding the CD8 count and a subset of CD8 cells that were elevated in patients who were benefiting from the immunotherapy. I mean, that is so important. The problem, I think, with immunotherapy in general is that there's so much hype about it that patients and physicians tend to use them until the very end. And that may mean that patients never get a chance to get on maybe other effective therapy because the doctors are afraid to abandon the IO. The so-called pseudo-progression, right? I think there are more papers written about pseudo-progression than there are patients who've ever had pseudo-progression. But it's because that everybody is hesitant to abandon the checkpoint inhibitors. So we really do need a handle on that. But that's huge. And hepatocellular carcinoma is just a different game than it was some years ago. And it's really been, it's amazing to see the progress there.